Okay, thank you everyone for joining us nice and early as always. My name is Rose Gerber. I'm the Director of Patient Advocacy and Education for COA. During last month's advocacy chat, we started off the year by focusing on COA's policy priorities for 2025 and how COA would be working with the current administration. Well, today we're going to continue talking about policy, but from a different angle. We're going to also include the personal angle. Many of you are probably aware of the Prevent Cancer Foundation. The Prevent Cancer organization was founded in 1985 by Carolyn Bow-Eldeje, who's not only known nationally, she's known internationally. And when she started the organization, she started it for a very personal reason, which Caitlin may mention in her own comments. What was very interesting about why she started the organization, though, is in the name gives it away, is there was all these organizations that focused on the cure, which of course we still want as cancer survivors, we always want a cure. But she introduced prevention as a topic that is so critical, and the organization is continuing their incredible advocacy work to this day. Some of you may also recall Bow-Eldeje's name because she was one of our very first advocacy chat guests, which I'm very grateful about. We started these in 2020 as a way to keep everyone engaged, and it's been a very popular series. So again, thank you for all of you who continue to be a part of this. Bo's presentation was titled Dare to Imagine, a World Where No One Dies of Cancer. And so many of our speakers have incredible titles for their talks, but that one, it really resonates with so many of us. We're still dreaming of that day where we can imagine a world without cancer. So again, thank you to Prevent Cancer Foundation for all the great work that they continue to do. Well, today you get to meet another one of their incredible staffers, Caitlin Kubler, Senior Director of Policy and Advocacy for the Prevent Cancer Foundation. Caitlin is going to give us an overview and updates from the organization that includes their policy work, their advocacy work, and then also a lesser known type of work that they do, which is in health equity. And as you know, COA focuses on health equity as well. So we're very happy to have Caitlin doing that work and sharing her work, as well as my colleague, Sheila, who is the head of our advocacy efforts. Excuse me, I got a little bit of a tickle there. Sorry about that. Okay, and then Caitlin's going to tell us about the latest updates on the Multi-Cancer Early Detection Screening Act, which is HR Bill 842 and Senate Bill 339. So Caitlin, we're very excited about having you here today, and we're all ready to learn from you. So take it away, please.
All right. Thank you so much, Rose. And hi, everyone. I'm excited to talk to you about this topic today. It's not often that I share my personal story in my professional life, but I am jumping in wholeheartedly today in the hopes that it helps advance this important work that we all do about raising awareness about cancer prevention and early detection. So let's go to the next slide. Okay, so here's me and my sisters and my cousins. I'm the one in the right picture in the cruise/beach themed jumper. I'm confident that I wouldn't win any fashion awards here with this getup, but I also do not recall that I selected that outfit. And then I'm on the right in the red hat. So you can see the towers in the background. I was born in New Jersey, and then my family moved us out to the country. And so important to share this. So people say in telling any story, you have to start at the beginning. So that's why I'm taking you back to my childhood. So from a young age, I remember that I've always been curious about space and animals and art and science, but especially the medical field. But I didn't really become fascinated about learning about cancer until I discovered years after the fact that my mother had stage 3 colorectal cancer when I was in middle school. So I pursued my passion in the medical field. I'm in high school, volunteering at the hospital. I became an EMT right out of high school. I volunteered with the local fire department in my college, where I was getting my degree in health sciences management at George Mason University. But I had no idea that my world was really about to completely change. So I'm in college, and what do you do in college when you're home for the weekend? You go get your laundry done and you get a hot meal from your family. So me and my sisters were all sitting around the dinner table, and just like someone asked to pass the mashed potatoes, my mom just blurted out, "Oh yeah, back when I had cancer." And I remember me and my sisters looked at each other like, "I'm sorry, what?" Wait, you had cancer? When? And, you know, we all obviously had a series of rather probably prodding questions, and, you know, she remained calm through each response, but it appeared that this was the first time, apart from my father, that any of us knew that my mom was diagnosed with colorectal cancer, and fortunately, successfully treated. So, she would later share with us that her gynecologist was the one who recommended a stool-based colorectal cancer screening test. She was not yet 50. I think she was 46 at the time. The recommended screening age at the time was 50. We know now it's 45 for those who are average risk, but her doctor thought something didn't seem right. I think probably based on some of the symptoms that she had presented. And they said, you know, let's just go ahead and get this test done. And unfortunately, it came back positive, and per guideline recommendations, we know the next step is a follow-up colonoscopy. That didn't obviously come back great. She had other diagnostics, and doctors ultimately confirmed that cancer had perforated the wall of her colon and spread to her lymph nodes. So my mother ended up having the entire right side of her colon removed. And she often jokes about to this day that when she goes to get a colonoscopy, that she should get a discount because she has a third less colon.
Does humor.
Right. So she had that removed. She had her appendix removed. She had 13 lymph nodes, and she spent the following 11 months receiving chemotherapy and other treatment, all while working full time. So we can go to the next slide here. So fortunately, I'm happy to say that any signs or symptoms from her cancer disappeared after 5 years, and today she is 75 years old and happily enjoying her retirement. There she is with my dad on the left, and in her cute shirt, and with me on the right. And so
Maybe you should read the shirt. It might be kind of hard
oh,
for
okay.
to see it.
So the shirt says, she is my sweet potato, and then from my dad's side, and then on my mom it says I am.
Cute.
So
Adorable.
always love a good pun. So you know, when I think back on this, it's still painful to think that, you know, my mother essentially went through her entire cancer journey mostly alone, and that, you know, she decided to omit such a significant life event from me and my sisters, and that she only told my dad, and she asked that we not share with any of our friends or family. But Rose, I know you kind of had a similar story.
Yes, I did, Caitlin. In fact, I was aware of who Caitlin was because of the organization, but I was really moved when I read her story. And like she just shared, that she did not know that her mother had cancer when she was a medical student and a middle school student. In my situation, when I was diagnosed, my children, my son and daughter, were 6 and 8 years old, so kindergarten and the third grade. And like Caitlin's mother, for different reasons, I chose to be very private about it. And that's how I chose my verbiage. Is I was doing everything I could to protect Alexander and Isabella. I did not want children scaring them, saying anything about my prognosis. So I was very, very protective. So when I read Caitlin's story, even before talking to her, I said, in my mind, I thought that's exactly what her mother was doing to her, even though her and her sister were in middle school. Your mother instinct kicks in, and I felt I could take anything, and I did, trust me, physically, emotionally. But I did not want any hurt or harm coming to my children at 6 and 8. And when I read her story, I said, this is the mother instinct that will never go away. And it's also very surprising. I want to share one more thing in the current media atmosphere that we're in, where so many people, and it's their choice, are very, very, very public about their stories. You know, they're posting from the chemo room if it's allowed, every single detail, no matter how graphic is posted. But there are cancer patients who choose to be private at that moment. And it's just another way to show that every cancer patient has the right to share their story their own way. And I definitely I would assume that your mother never meant to like hurt you in any way. She was probably just
No.
protecting you. So thank you, Caitlin, for sharing that.
Absolutely. Yeah. I mean, so when I was asked to share my story for one of awareness blogs that we do at Prevent Cancer Foundation, as being a member of the external affairs team, you know, you have to fill every role there. So I sat down and I wrote out my story. And I went back and I said, you know, Mom, do you recall your thinking at the time? Why didn't you tell us? And you know what, Rose, it was the same thing that you said. She said, you know, I never really thought I would die, and you were young, and I wanted to protect you from, you know, the heartache and the sadness and the other people making comments.
Yes,
Um,
exactly.
and, you know, I obviously still have feelings about that. I mean, I'm an adult now, she's an adult, and I hate that she had to go through all this alone, but I know that was, but I am also not a mother.
Right.
And I know that ultimately that was her decision to make. And so what I take with me is that the fact she had an amazing healthcare team of surgeons, oncologists, providers, and that she is here today to teach us that, you know, knowledge is power. But for me, really, knowledge is empowerment, because as a result of my mom sharing her diagnosis with us, my sisters and I are now empowered to take charge of our health. And we all have started our routine colorectal cancer screening earlier than most, obviously, because of our elevated risk from family history. And so I'm proud to say that so far it is so good for us.
Right.
So now I spend my entirety of my professional career advocating for policies that support cancer prevention and early detection, and I'm happy to talk more about those priorities now. So next slide. So as Rose mentioned, back in the days of Bo Aldeje founded our organization. We're actually coming up on our 40th year anniversary this year. So we are a nonprofit organization. We are headquartered just outside of DC in Alexandria. And we are the only organization that has been solely focused on advancing prevention and early detection. And so like Rose said, when our organization was founded, there weren't others in the space of prevention. They were primarily on treatment. And we now know just how important it is to have those conversations about your health before you're sick or before disease has progressed, because that's when you can build trust with the healthcare system and confidence in how to navigate it, not when you've come down with an, you know, advanced cancer diagnosis. That's not the time. So that's why at Prevent Cancer Foundation, our mission is to empower people to stay ahead of cancer through prevention and early detection. Next slide. So we are considered a patient advocacy group, although we are really a people advocacy group, because our audience is the general public, and our work is categorized across 4 pillars. Funding research in our space. We are a source of seed funding of ideas so that people can qualify for larger federal grants. And we know with the current environment just how important that is. We advance policy to ensure access and funding. We provide education to the public and resources to communities who engage in this work, particularly for people that would otherwise not have access. So ultimately, we look to make sure that no one really gets left behind. All right, next slide, please. So here is an example of some of our work here on this slide. Our resources. We have a screening and vaccination chart, which conveys which cancer screenings you need, when to begin screening, how often you should be screened, and then a family history chart that can be shared with your healthcare provider and other family members, and then a cancer screening quiz that also shares our chart, and then a guide to prevent cancer, which we now have available in Spanish, Mandarin, French, and Vietnamese. Next slide.
Caitlin, excuse me, if you said this, I may have missed it. Is everything also available digitally, or is like hard copy, how downloadable? What is that?
Absolutely. Great question, Rose. Yes, I will share the link to our website at the end of my chat, but these resources are all available on our website for download. You can print out a copy. You can keep the electronic version, whatever you need is available there.
Thank you.
All right, so I want to talk a little bit about the research that the Prevent Cancer Foundation has conducted through our early detection equals better outcomes survey. And we have done this for a few years now, and I'm happy to say that we are currently in the process of going through our 2025 data, and we will be reporting that out in April. But for now, I want to share some research that we gathered from our 2024 survey, which found that nearly 7 in 10 Americans, 21 years of age or older, that's the group that's screening age, said that they're not up to date with one or more cancer screenings. And the reasons that they said were, they didn't know they needed to be screened. 43% said that. 38% said they don't have a family history of the disease. So perhaps we've over-indexed a little bit on the risk of family history there. 33% said that they didn't have any symptoms. So clearly there is some work for us to do in the prevention and early detection space there. We also found that a number of people said continued innovation with less invasive tests and more home options. 41% said that having an at-home test option would make them more likely to prioritize a routine cancer screening. Unfortunately, we know that there are some new products that have come on the market and come available. So hopefully we are working to break down some of those barriers there.
Caitlin, excuse me, may I ask a
Sure.
question about the at-home? Because I'm thinking this might be something the audience would be interested in. Do you think any of that is privacy related? Like when I think about your mom and myself, I mean, I know some tests you have to go in, diagnostic, but could it be anything along that line, or what are you seeing or hearing?
I'm not sure necessarily about the privacy. Some of the tests now, you would still have to go into the doctor's office,
Okay.
but I think it possibly could be. I mean, I know Cologuard is very successful, and maybe that's because you're able to do that in the privacy of your own home. You don't have to go in. But I know a lot of people, they're not comfortable going into a doctor's office. The white coat syndrome, right? Your blood
Yeah.
pressure goes up. But additionally, people have trouble getting to the doctor.
Right.
Right? It requires you to take time off, to
Right.
find childcare. And a lot of people just can't do that. So they're like,
Right.
you know what? I'm just going to put it off. And then unfortunately, until a symptom appears, people don't go in.
Right. Because I've heard a lot, over my, 2 decades of advocacy that pharmacy, especially for people who live in small towns, a lot of people just don't even like going to their local pharmacy because of privacy issues. They don't want, their teacher, the pharmacist happens to be their teacher's best friend or, so I'm
Yeah.
curious about that. And it's a real issue for people in small towns. So just curious. Thank you.
Yeah, absolutely. So we also found that in addition to the less invasive test, I think a faster test result, right? We hear a lot about this,
Yeah.
having to wait for your test. I don't know if that's something you experience, Rose,
Oh,
but
yeah. It's
especially,
nerve-wracking.
yeah, it is. So, and then finally, I'll share that when we did share information about the benefits of early detection, 73% of adults reported an increased likelihood in actually scheduling their cancer screening.
That's
So,
wonderful.
so that shows that hopefully our campaigns and our information
Right.
sharing is working.
Mhm.
So next slide. So obviously I'm a little biased here, but out of the 4 pillars, this is my personal favorite, and that's advocacy. What do we do? Well, we influence public policy, and we do this at the federal level. We also raise awareness. We host an annual advocacy workshop, and we do follow-up advocacy roundtables for industry groups. We also send an advocacy newsletter that goes out the first Friday of every month, and I'll share information at the end on how you can access that. And that shares the most current advocacy and policy news. And I also want to mention that, we connect and we coalesce with other national cancer advocacy groups, just like COA here. So, we know there is so much important work being done in this space, and we're only able to cover a portion of it. Now, shout out to my colleagues that are on this call. We do have a small but mighty team at Prevent Cancer Foundation, but we do rely heavily on our partners in this space to keep us informed about other work that's happening in diagnosis and treatment and the clinical trial space. At the moment, we are currently exploring the impact of minimal residual disease, or MRD, as we're finding it too is part of the conversation around early detection. So our priorities are to increase federal funding for cancer prevention research and those programs, and reduce health disparities. Oh boy, is that a big one now more than ever. So I will point out that I am one of the co-chairs of the Health Equity Work Group at Prevent Cancer Foundation. We believe firmly that everyone deserves an equal opportunity to stay ahead of cancer through prevention and early detection. And the foundation works so hard to reduce disparities in those four pillars that I mentioned: research, education, outreach, and advocacy. And so part of this work is we support community partners to reach medically underserved communities and fund innovation that could possibly lead to the next breakthrough in cancer prevention and early detection. And I know, Rose, you mentioned that COA is also a dedicated partner working to advance health equity and reduce disparities in this space.
Yes, and earlier when I got a little choked up because I didn't drink my water, I wanted to mention my colleague's name is Sheila Palencia. So if any of you would like any more information about that, you can feel free to email me and I'd be happy to connect you with Sheila, who can give you some updates on what we're doing in that space. And we do have a question, Caitlin, in the chat. So I'm going to read it to you. And if I get it wrong, hopefully our sender will let us know. So did anyone say they didn't fall in the guidelines, like being like lung cancer screening?
You know, that's a very good question. I have to go back to my colleagues and check on that, but I imagine so. I mean, I know at least with lung cancer, I think it's over 50% of people who've had lung cancer detected wouldn't have qualified for the lung cancer screening guidelines otherwise. So, let me get the answer to that, and I'll follow back up with you, Rose. Great question.
Yes, and you know, what I always say with these chats is that we, as the speakers and hosts, we also learn together. So we are really all about learning. So we do appreciate your questions. Thank you.
Thank you. So finally, we support legislation that improves access and prevention to an early detection. Next slide. So ultimately, advocacy is about using our voices to drive change, right? So it influences public policy, funding, and laws to ensure that people have access to prevention and early detection. But it's more than just raising awareness, right? It's about turning that awareness into action that leads to real measurable improvements. And we know if we look at the 5 cancer screening types that are covered by Medicare, though 4 out of 5 of those, we have breast, colorectal, prostate, cervical, and lung. The first 4 of those all had to come through a legislative vehicle to give Medicare the authority to be able to cover those. So we know that advocacy is how we move from the research to reality, and that ultimately scientific breakthroughs, they don't matter if people can't get access to them due to policy barriers. So without advocacy, critical cancer and prevention programs wouldn't exist. And policymakers, they need to hear from real people, not just the experts. So when constituents share their personal stories, lawmakers really listen, right? So statistics can be very powerful, but a story is really what moves people to action. And so I want to just share 2 real world examples with you. If we go to the next slide. The first one is Cancer Prevention and Early Detection Month. So this happened last year. We reached out to our advocacy network and we asked our partners to help us in securing a national proclamation for April 2024. So over 80 groups joined us in requesting that the White House designate this to be the first national proclamation for cancer prevention and early detection. So there's many other awareness months out there, but there wasn't one focused on cancer prevention and early detection. So throughout that month, we shared the many resources I've just talked about. We had a satellite media tour. We had a reception on the Hill to honor our advocates in the cancer prevention and early detection space. And we ultimately encouraged our partners to spread the word about the importance of cancer prevention and early detection. So we move to the second example I want to share real briefly, which is the Medicare. Trying to get to the next slide. There we go. As Rose mentioned, the legislation that we are proudly supporting is the Medicare Multi-Cancer Early Detection Screening Coverage Act. Believe it or not, that is the short title of the bill. So the foundation led an endorsement letter. We garnered over 520 signatures from advocates all across the United States that represent patients, providers, rural health, minority health, and many more. And ultimately, they supported us on this legislation that would give Medicare the authority to make a coverage determination for multi-cancer early detection tests once they are approved by FDA and shown to have clinical benefit. And I'll pause there. Rose, do we think most people know what multi-cancer early detection tests are, or should I just give like a quick
I think you should give an overview. They do not.
primer? Okay, so
We're here to learn.
Sure. So multi-cancer early detection test is a blood test that you can receive that has the ability to detect over 50 cancers. Some of them are already on the market, but they are not yet covered by insurance and not yet approved by the FDA. So these are technologies that have very high hopes, but still going through the regulatory process. So our partners joined us in support of this legislation, and we're hopeful that we can advance this because, you know, advocacy is ultimately about closing health disparities. We know not everyone has equal access to screenings, and so we need to make sure that we fight for policies that ensure that everybody in every community can benefit from the healthcare that we have. So as I close out, I just want to make a couple important notes, and that here's the link to our website, all of our social platforms. My marketing team will hopefully be very happy with me for sharing these.
I love you.
I want to note that if you are an industry or an advocacy group and you would like to partner with us, just let me know. You can find my information on the next slide there. And that I want to note that, you know, cancer is something that I think touches all of us. But together, I think we can create a future that Bo envisioned where more lives are saved through prevention and early detection. And your voice, your advocacy, and your support makes so much of a difference. So thank you for allowing me to chat with you today.
Thank you, Caitlin. That was wonderful, so informative. Thank you again, really, your personal story. I think the way you opened up this chat was really impactful. And then also your photos of your groups being on Capitol Hill. You're right, because our members of Congress, their aides, they do want to hear the personal connection, especially with so many different groups going up to the Hill. It's very easy to actually forget the true patients. You know, it's easy to say the word patient, say the word survivor, but I know we had our own Patient Hill Day in May of last year, and fingers crossed we're going to have another one this year, date to be determined. And it's really moving not just to the patients who share their story, but to our members of Congress. So you know, it's all these groups working together. And again, thank you so much for your leadership in this space. I've been to your advocacy workshops in Washington. They're great. So we love to support you as well. Thank you. And if anybody wants to see these slides, reminder, they will be on COA's YouTube page. If you have any questions for Caitlin, you could send them my way, or you can find Caitlin on the Prevent Cancer Foundation website. Next slide, please. So ways for you to become a CPAN advocate as well is reminder, you can participate in these chats, share it with your friends, colleagues, any advocacy groups, sign up for our CPAN newsletter. You may have noticed it's not monthly anymore. It's going to be quarterly, so you'll be seeing that soon. Visit the COA and CPAN website to learn more and take action. Share your story. You know, one of the first ways that many advocates start sharing their story is by writing it down. Caitlin spoke about how she wrote a blog. You can share as little or as much as you want on our website. And of course, follow us on social media at coadvocacy.org. And one last slide before we say goodbye. So next month is National Nutrition Month, which is the perfect time to have our wonderful guest, April Rosso, who's a clinical nutrition manager from Florida Cancer Specialists and Research, one of our huge community practices, and they've always been so supportive of CPAN and community oncology in general. And whether you're a cancer survivor who's newly diagnosed or a long-term survivor like myself, or just a member of the public, we all want to learn about nutrition and how to do better. And it, again, ties into preventing cancer or hopefully keeping it at bay. So I will see you next month on March 12th. Thank you for being with us today. And thank you again, Caitlin.